Hey, this is Dr. Myers, Dr. Derm, here to talk about melasma, our nemesis. Melasma is when you get excess pigmentation associated typically with like hormones or medicines that you're taking to change hormones and sun. That's your two big triggers, changing hormones and sun. So common annoying places where you get melasma could be the cheeks, it could be the upper lip, it can be other areas on the face, and you can even get it melasma, say on the arms, like the forearms. It's more common in darker skin or darker skin types, or those who tan more or who have more pigment in their skin. It is exacerbated in the summer. It is the best time is like the end of the winter. The worst time is like today, mid-August, because it's the end of the summer. Even those who have been really diligent to protect themselves from the sun, it's hard to be perfect. So what is the treatment for melasma? Number 0 would be, hey, don't change your hormones and breastfeeding, pregnancy, all those things, but those things are happening, and that's when melasma starts. So number 1 would be sun. So you protect yourself in the sun. You do that however you can. You do that from sunscreen, sun hoodies, other protective clothing, or cool hats. Oh, and you avoid the peak sunshine hours, like really 10 to 4, 10 to 5, depends on where you live. So that's number 1, sun protection. Number 2, creams. So really, the primary cream that we've been using for many years is hydroquinone. Hydroquinone's amazing. It's like 2%, 4%, it's 8%. And it can be used as a compound, which is typically how we use it. Hydroquinone, if you used it nonstop or at higher doses, very, very rarely can cause permanent problems, and thus some people shy away from it. But most of the time, hydroquinone's a good medicine as like an additive and one that you can be using to help the melasma. So it's a lightener, it's a brightener. So other things that we add with hydroquinone include is tretinoin, and it is a mild cortisone. So like for instance, in the very first medicine that was approved for melasma, like a compound, had a little bit of hydroquinone, had a little bit of tretinoin, which is retin A, and then it even had a mild cortisone, very mild one, just so it decreased inflammation, because these other creams can cause a tiny bit of inflammation. They were just a good complement for each other. There's a lot of other botanicals and other topicals that help with melasma, like kojic acid, and let's say 20 more. There's a ton. And so we do use some of these and add them to these other prescriptions, and it's great. There's other type of non-hydroquinone creams that can help with skin brightening and skin lightening. There's over-the-counter, there's prescription. There's a lot of options. I typically do a little combo of something prescription and something over the counter. Just depends on how much the patient has as far as melasma. Number 3 is probably a treatment, and that's usually a chemical peel. Chemical peels are decent for melasma. I wouldn't say they're smoking amazing. They're a good additive along with the number 1 and 2. We have chemical peels that are specific for melasma. Number 4 is laser. There are some lasers that are good for melasma, and there's others that are ho-hum. So a lot of people tout such as IPL or photofacial, because you can target browns and reds, and hyperpigmentation, and even increased vascularity in the face. It's a jack of all trades, master of none. And people can actually bounce back, and that heat from the IPL, from the photofacial, can make the melasma return quickly. But so you get this honeymoon for the few weeks after, then it's right back. I don't do photofacials. I think there's too much heat and energy used, and too much risk of returning melasma. If you use lighter lasers that target, that have different targets, they're more tolerable, and that's the type of lasers, such as a Clear and Brilliant, that we use. Number 5 is a pill called tranexamic acid. Tranexamic acid has been around for a while. It's usually used to help someone promote clotting. So if someone has a heavy menstrual cycle or whatnot, they could take this medicine. But taken in low doses, this has been shown to decrease melasma. And again, I use all these as kind of in combination, because they each do their little part to help decrease melasma. So lastly, it'd be kind of part of 2. There's so many different type of topicals that you can use. For instance, there's a non-hydroquinone, really nice product made by Skin Medica called Even and Correct. sometimes I call it like Lytera 3 because it took over from Lytera 1 and 2. It's a non-hydroquinone. It's a good topical to use. Backing up a little bit. Why is melasma hard? Because we are trying to treat a hyperpigmentation of the skin, but not overly wipe out the cells that are making this hyperpigmentation. We don't want to take away all the melanocytes, then you'll be left with hypopigmented or light areas. So it's like, how do we perfectly target the amount of melanin that we want to back off without affecting the patient's normal skin type? That's hard. That's why I said it's our nemesis. It is tough. And especially if someone is in the middle of being pregnant or breastfeeding or taking birth control, any of those, it doesn't make it easier. And summer doesn't make it easier either. So that is your melasma list. Hope that helps. And if this does start, you can start yourself doing your sun protection. You can always follow up with your local dermatologist and get some additional help from them. Hope this helps. Have a great fall. Be safe out there, and thanks for watching.